I am so glad to have Dr. Lindsay on because you're going to answer a question that I have no idea what the answer is. How do you know what the future is going to be when it comes to health? You guys always know how to anticipate something, and I don't know how you do it. Where do you begin with that?
Well, part of the process that we're conducting right now is a community health planning process that we call MAP.
Okay.
And MAP stands for Mobilizing for Action Through Planning and Partnership. It is a process that involves community assessment and then a community health improvement planning process.
Now, when we talk about community health,
Yes.
are you talking about the flu is going to come next year or the common cold, or how do you define that kind of health?
When we talk about things like the flu coming during the flu season, that's a part of our ongoing activities that we do in public health called surveillance.
Okay.
But this is more looking at our community and most importantly getting community input and ownership involving health issues. And when we think about health, it's more than just disease. We're talking about lots of different things that impact health. And a lot of that has to do with how we live, work, and play in our community. The social environment, the environment in general, as well as our health risk and behaviors that impact how healthy we will be as a community.
Yeah, because I guess when you watch those morning TV shows, they have the docs come on, and it's about the latest epidemic, or how are we going to be prepared if there's some kind of terrorist? I mean, you're still doing that kind of thing.
Those things are very important, but it's also important that we understand and appreciate how what we do and how we live in our day-to-day lives impacts our health. And prevention is much more important than waiting until we have an illness to treat it.
Look, you're talking to a guy here who likes to be in denial, right?
Right.
And it's not until you get sick that you go to the doc.
Right.
So you're kind of talking about before you go to the doc for the annual, go to the doc when you feel healthy.
Yes.
So,
but also think about your day-to-day life and incorporating activities or behaviors as part of your routine way of life to stay healthy. Your choices about eating, about walking, staying active, choices along that line.
Okay, so what kinds of things are you hoping to hear from the resident?
In general, this part of the process that we're conducting right now is called the Community Health Survey.
Mm-hmm.
It's part of our Community Themes and Strengths Survey. We're wanting to find out from people in the community what they see as strengths in their community that help positively impact health needs, and their interests, so that we can prioritize the issues that we want to work on moving forward to promote health in our community.
So how does the resident get access to the survey?
It's very easy. It's a very short and brief survey. It's only about 3 minutes to complete. You can access it through the norfolk.gov website, www.norfolk.gov/health survey. Or if you don't remember that, you can just Google Norfolk Community Health Survey and it will come up.
That sounds mighty easy.
Yes, it's very easy.
Now, and again, like the city is also doing some asset mapping, which are kind of physical attributes of the city and really building toward the 21st century. So, or the 22nd century, I guess it is. So, some people would say, okay, they're going to ask us these questions, but then what are they going to do with it? So, what are you going to do with it, with the information you get?
It's very important that the process engages the community in both directions. Not only we will be talking to the community and talking about what we're hearing from people in the community and also from health professionals, but we also work together to prioritize what the issues are that we want to work on, and we plan together looking at strategies to improve health.
Something's going to tell me that the strategies are going to include more than just the health department, but all of your partners in the community too.
Yes, and a lot of times we think of public health as just being the health department.
That's right, the docs you're going to make as well.
Right, but public health or community health involves actions from all of us. We all contribute to the health of our community.
What are some of the big issues that you see out there facing us for the future?
I think
having not taken the survey, recognizing that. But what are some of the big issues?
Well, if we look at the leading causes of death and indicators of health issues in our community, we see a lot of similar themes that we would see in other urban cities. Cardiovascular disease, which you're going to talk about later, cancer. We have significant issues with infant mortality. We have also have issues with mental health and mental health resources in our community, just to name a few. However, when we look at what we can do to improve our health, there are many things that we can do that really address a lot of those things on the prevention level that are fairly simple in terms of choices of our diet, being very active. Like I said, walkability is something we're talking a lot about in our city to improve people's opportunity to engage in healthy behaviors without thinking about it.
Right. See, why did I just feel like I sat down with my wife who's telling me get out there and walk and do some of those healthy things? It's that simple.
And get your flu shot.
And I got it on the show.
Great.
By one of your
Glad
staff.
to hear
It was, and I'm not going to get the flu then, right?
I saw that. Well,
Yeah.
it significantly improves your chances not to get it.
And I've never had a guest before tease the next segment. So thank you, because as we saw in the last segment where you've got looking out for each other as a resident,
Yes.
there's also other partnerships out there between the city and our health community. So thank you, and
Thank you.
take the survey. It's easy. Go to norfolk.gov and //
Health survey.
It's really simple, so go do it.
Yes.
Thanks a lot.
Thank you very much.
When we come back, we're going to talk about this very special relationship that benefits you between